Hi everybody, we're going to pick up with articulations, and we can kind of consider this to be a subset of the skeletal system. In your course pack, this information begins on page 72. Now, I cannot stress enough how this is dry material, and you may want to use flashcards here. If you don't use flashcards, then I would get into the lab, look at some skeletal system models, practice with those, get this stuff to stick by constant repetition. So I think flashcards can probably be one of your best bets. You may want to check out Quizlet.com and see what they have to offer. So articulations are simply joints, and it may come as a surprise that not all joints are freely movable, like your elbows and knees. Some joints are simply immovable. We can say that a joint is anywhere two skeletal system elements come together. And now skeletal system elements are things like bones, cartilage, things of that sort. So we're looking at places where skeletal system parts come together. Okay, so we can classify joints as functional, meaning how movable are they, or we can classify joints as structural, meaning what are they made of. I cannot emphasize enough how important it is for you to keep these two categories separate. Functional means how movable the joint is. I'm going to write this down here. Okay, so we're looking at, Synarthroses, Amphiarthroses, and Diarthroses. The least movable of those categories is called Synarthrosis. The most movable in that category is called a Diarthrosis. Structural classification of a joint is basically what is the joint made of? Okay, so some of our joints are fibrous, some are cartilaginous, and some are synovial. So you probably heard of these terms before, but we're going to really dive into what they mean. Now, when you're learning these functional and structural categories, you can kind of say that Synarthroses are usually fibrous or cartilaginous. So you can kind of come across here and do this number. You can also say that Amphiarthroses are fibrous or cartilaginous. So you can come across here and you can do that number. Now, Diarthroses category is only classified structurally as synovial. So that is the only way that those two correlate with each other. Functionally, freely movable joints known as Diarthroses are structurally known as synovial joints. Okay, so we'll talk through all of this in more detail over the next few pages. So let's talk about Synarthroses for just a moment. I want to be clear that a Synarthrosis is literally a together joint. Syn means together and arthrosis means joint. Now, this is a functional category, okay? So we know that Synarthroses are not movable. So keep that in mind as we talk about how they structurally can be classified. Immovable joints may be classified as fibrous in nature, or they may be classified as cartilaginous. Fibrous joints are ones in which bone and bone grow together. Skull sutures are a great example here, as are gum foci. You may recall that skull sutures are found between the skull bones, such as the lambdoidal suture or lambdoid suture in your skull, sagittal suture, coronal suture, and so forth. Now, gum foci are actually teeth joints. We know that teeth grow in two bones, mandible and maxilla, and of course the gum foci are where the teeth actually join in with those bones. So in each case here, the skull sutures and the gum foci, there is bone growing directly into bone. There is no gap of space between the two. Now, if you've got cartilage between two bones, we classify this Synarthrosis as a cartilaginous joint. Cartilaginous joints are ones that have, of course, a piece of cartilage. Maybe it's hyaline cartilage between two bones. We'll look at synchondroses in just a moment, but they are actually found between the ribs and sternum and also between the epiphyseal plate, which that joint creates between the epiphysis and the diaphysis of the bone. All right, so here are some functional Synarthroses. Structurally, they are fibrous joints. So skull sutures are, of course, these areas where your bones knit into each other, like you see here. Okay, so if you had a picture of a skull and you were asked to identify the functional category of those skull sutures, you would say it's a Synarthrosis. However, if that picture shows you skull sutures and it asks you for the structural category, you would say it's a fibrous joint. Okay, see how that works? The functional classification here is Synarthrosis. The structural classification is a fibrous joint. Fontanelles are actually what we see in babies up until around year 1 or 2. These fontanelles eventually grow together where bones knit into bones, so babies may not have fully formed skull sutures yet. But after the first year of life or so, we tend to see those bones expand to let the brain grow, and of course those bones will start to knit together and harden. All right, so here are teeth joints. If you were shown a picture of teeth, you would say functionally they're immovable, meaning they're Synarthroses. Structurally, we classify them as fibrous joints because it's bone and bone coming together to form that joint. Let's talk about this final type of Synarthrosis joint, the epiphyseal plate. And I'm going to outline it here for you. That's this region of cartilage that travels through the end of the bone, right through there. I'm just going to label that as epiphyseal plate. Okay? Now, that epiphyseal plate is composed of hyaline cartilage. It is situated between bone, spongy bone, and perhaps some compact bone. But nonetheless, it is a type of joint that is not meant to be movable. No one wants this particular part of their bone to ever move. So structurally, this is a cartilaginous joint, and we call it a synchondrosis to be very specific. That implies that this is a piece of cartilage wedged between two pieces of bone. All right, and here's another look at an epiphyseal plate. This is right through here on the femur, and you can see it pretty clearly down here on the tibia. That little dark line that travels through there, that is the epiphyseal plate composed of cartilage. And in fact, that does create an immovable joint. So if I were to ask you the functional category for this epiphyseal plate, you would say it's a Synarthrosis. Structurally, we're wanting to know what it's made of. It is a cartilaginous joint, and more specifically, it's a synchondrosis, literally together with cartilage. All right, so now we're moving to our second category of functional joints. Amphiarthroses are somewhat movable. Amphi means on both sides or surrounding. We know that arthrosis there means joint. Now, these joints have a slight degree of movement, and again, they can be classified as cartilaginous or as fibrous in nature. You probably are going to see so many words here that begin with syn, S-Y-N, or sim, S-Y-M, that it becomes very confusing. And once again, let me just re-encourage you to use flashcards to help this stuff stay straight. So cartilaginous joints may be classified as symphysis joints. Fibrous may be classified as syndesmoses. All right, so let's take a look at this pubic symphysis right here between the two pubis bones. That pubic symphysis is a piece of cartilage between those two pubis bones. Now, that piece of cartilage is meant to provide a small degree of flexibility. When I talk about how flexible that joint is, you want to think functional or amphiarthrosis. Now, when we talk about what that joint is made of, we want to think about structural category. It is a cartilaginous joint because it's cartilage between two pieces of bone, and specifically, this type of joint here is called a symphysis joint. Here's another example of an amphiarthrosis joint. Keep in mind, the functional category is amphiarthrosis, meaning this joint has some degree of flexibility. Structurally, we're talking about cartilaginous joints. That is a piece of cartilage wedged between two pieces of bone. These are symphysis joints because of that construction. The vertebrae of your back are layers of intervertebral discs made of cartilage and a bone. So that repetitive structure is what we think of functionally as an amphiarthrosis and structurally as a cartilaginous joint. So this picture here shows a couple of other places of the body that you may find that, including, that set of discs in the back. Let's switch gears and talk about a different type of amphiarthrosis. This is a fibrous joint here. Fibrous joints are actually joined together by ligaments. Ligaments, as you can see here, bind one bone, this one here, to another bone. So this piece of ligament is formed by dense regular connective tissue. It does contain fibers of collagen, thus the name fibrous joint. Alternately, we can call this type of joint a syndesmosis. Syn meaning together, desmo meaning band. Okay, so syndesmosis are the types of joints formed by these ligaments. You've got them between your ulna and radius, and here you can see an example between the tibia and fibula. Now, because these are joints that provide a small degree of movement, we functionally classify them as Amphiarthroses. All right, if you'll flip on over to page 73 with me, let's talk through the diarthritic joints. Diarthroses are classified functionally as freely movable joints. Structurally, we discuss them as being synovial joints. So let's talk about what a typical synovial joint may contain. A typical synovial joint has a cavity filled with synovial fluid. We've already learned that synovial fluid is meant to lubricate and help reduce the friction when these bones are set near each other. There is an articular capsule in here. It's a fibrous capsule, and that capsule has a membrane lining it called the synovial membrane. That membrane is the one that produces the fluid for this joint. So your elbows, shoulders, fingers, wrist, hips, knees, ankles, and toes all have these diarthroses synovial joints, freely movable, and these capsules lined with synovial membrane. Let's talk about the parts of the capsule. You also have articular cartilage that covers the outer surface of the epiphysis of the bone. So you can see here in blue, this structure here and here covering the surface of that bone is articular cartilage. And again, that helps to reduce friction and lubricate the movement in that joint. We've already looked at the synovial fluid. That fluid, of course, helps to lubricate that joint. Think of it like the Tin Man in The Wizard of Oz. He had to be oiled up with, lubricant in order to get his arms and legs moving. Now, what you don't see from this picture are fat pads that are behind the knee or behind the elbow, for instance, or padding and cushioning that joint. There also are tendons and ligaments that hold together these joints. Ligaments binds bone to bone. Okay? Ligament binds bone to bone. Tendon binds muscle to bone. I had a student many years ago share a really great tip, and I'll pass it along for you. She said that Larry buys books. So if you remember that LBB means ligaments bind bone to bone, that'll help you keep ligaments straight from tendons. Tendons anchor muscles to bone. Okay? Now, let's look at bursa. Bursa are little sacs, so if you were to draw some, they would be scattered throughout this area here, and they're just little sacs of synovial fluid that kind of act like cushions for these joints. So if you've heard of bursitis before, you've heard of an inflammation of those bursa sacs, literally little sacs that help to contain fluid and reduce the friction around that joint. Just a side note here, this is not anything that's part of your test. I thought you'd be interested to see that there are problems that arise in these synovial joints, and arthritis is one of those classically known types of inflammations. This inflammation of the joint can ultimately destroy cartilage or even bone tissue as the inflammation erodes away those tissues. Rheumatoid arthritis is actually an autoimmune disease that helps to destroy the joint structure that you see here. Here's another look at how rheumatoid arthritis can cripple a set of joints. Gout is more common in men, while rheumatoid arthritis is more common in women. Both can be very painful, but their underlying causes are certainly different. In gout, or gouty arthritis, uric acid crystals can actually build up in the joint and cause pain. So there are some places like the big toe where gout commonly shows up. So eating certain foods like meats or seafoods can increase the risk of gout attack for those who are at risk for it. And you can see here some common places are like the big toe in the feet and ankles, less commonly so in the arms. All right, so let's wrap this up with page 74. We'll talk about some synovial movements here. First off, you'll notice at the very top of the page are linear motions versus angular motions. Linear motions are gliding types of movements, like you would move your hand in this image along one plane. Angular movements are ones that actually change the angle or distance between two parts of a joint. So if you bend or flex your elbow, you change the degree or the angle between the bones that form your elbow. If you straighten or extend your elbow, you increase the angle there. So angular movements are what we're actually going to discuss below on your worksheet. Let me point out that these are also great for flashcards. You'll want to be able to identify movements and also understand the descriptions and identify them as well. The brackets are around opposite or antagonistic motions. So as you read down the list here, flexion and extension are opposite or antagonistic motions, as are dorsiflexion and plantar flexion. The only two on this list that are not opposite motions are numbers 7 and 8, circumduction and rotation. So let's talk about flexion and extension. To flex is to bend, to extend is to straighten. If you bend your elbow, for instance, that is flexion. If you straighten your arm out, that is extension. Flexion may also occur in the foot area. Here we call it dorsiflexion and plantar flexion. If you flex your toes up, as if you're moving them toward the back surface of your body, we call that dorsiflexion. Plantar flexion is actually straightening your foot out, but because you're bending the ankle the other direction and you're pushing your toes down toward the floor, we call that movement plantar flexion. In other words, planting your toes on the floor is plantar flexion. Keep those prefixes in mind. Dorsi means back, plantar means putting your toes or planting your toes down. Let's talk about abduction and adduction. Let's emphasize the prefixes here, AB versus AD. Ab means away from. Ad means toward. So if you're performing abduction and adduction, you're doing jumping jacks. When your arms and legs move away from your body, you're performing abduction, abduction. When you add your arms and legs back to your midline, you're doing adduction. So keep in mind that these are antagonistic actions. They are doing the opposite job to one another. Let's also talk about circumduction, shown here in this picture. Circumduction is actually a combination of ab and adduction, as well as flexion and extension. So if you were a little kid and you ever moved your arms in circles around your body and went around the house saying, "I'm an airplane," you actually performed circumduction. So it's moving your arms or your legs, which is a little harder, in a circular motion. Now, circumduction and rotation are standalones. They are not antagonistic actions. They are not opposite to one another. Let's talk about rotation. Rotation is the movement of a bone around its longitudinal axis. So if you take your arm, for instance, hang it down by your side, and move your shoulder where your hand rotates back and forth, that's a type of rotation. If you shake your head no, moving it left and right, you're also performing rotation. You may also be able to rotate your leg at the hip joint. So if you're moving that body part along its longitudinal axis, that is a type of rotation. Pronation and supination only occur at the wrist, while way earlier, dorsiflexion and plantar flexion only occur at the ankle. So here you can see supination and pronation have to do with the way your arms and hands are angled. If your palms are facing upward, as if you are carrying a bowl of soup, you're performing supination. Keep that in mind. If you're carrying a bowl of soup, you're performing supination. If your palms are down in a prone position so that the palms face posteriorly, you're now performing pronation. So if you think about zombie movies, sometimes they walk with their arms straight out in front, palms facing down. That's a prone position for those hands and that wrist. So these again are opposite or antagonistic actions because they allow us to do the opposite thing with our wrist and hand areas. Inversion and eversion are number 11 and 12 on the list. They are opposite actions that only occur at the foot and ankle joint. Inversion is moving your foot toward the midline. Imagine if you walk in a parking lot and step on something. If you move your foot toward the midline of your body to see what's in the bottom of your shoe, that's inversion. If you take your foot and you move it away from you or away from the midline, you're now performing eversion. Most people that fall down the set of steps and twist their ankles actually have an inversion type of injury. We don't often perform eversion types of injuries. Numbers 13 and 14 are opposite actions, elevation and depression. Elevation is lifting up a body part, while depression is lowering it. You can do this with your mandible. You can also do this with shrugging your shoulders as well. Finally, the last two set of antagonistic actions are protraction and retraction, and they have to do with moving a body part forward anteriorly and back posteriorly. The example shown here is a mandible being protracted forward or anteriorly and then being retracted posteriorly. So we continually see these types of antagonistic or opposite reactions, including these two here. These are great for flashcards. I highly recommend you stick these on flashcards to help keep them straight. The pictures that you see in your course pack over on page 75 will appear on the test along with some definitions. So when you're making flashcards, you may also want to use those pictures to help you keep this stuff straight.